Cool. Hey guys, Simon Roos from Fluid Physio and Gym and from Altitude Physio down in Thredbo and Falls Creek. And ski time again, we're all getting excited. And a really important thing to talk about so you can enjoy your ski trip is to take care of your knees. There's a lot of people who we see down in the ski fields and runners and people everywhere who get what we call anterior knee pain, pain under the kneecap and in the kneecap area in the front of the knee. So it can be a challenging condition for people because it's not always clear what you need to do to get the best result for yourself. You're definitely not going off and getting surgery. You're definitely not doing anything silly like that. It's a matter of understanding the condition and understanding what you can do to best help it. Now, one of the main mistakes I see is people have a knee problem and they just want to exercise the knee and get the knee stronger. But sometimes that can overload the knee itself, and then you end up with a sore knee when you were trying to help it. So what we want to do instead is we want to take the attention away from the knee and strengthen the hip. And there's some very specific muscles that we try and train in the hip. So you don't put the load through the knee, you put the strength into the hip. Some specific movements in the hip that we can train, because those two joints kind of do a similar thing. They get you up from a squat position. The hip comes up, and if the hip does more, then the knee doesn't have to do as much. So if we're talking about skiing, and we're trying to help knees when you're skiing, your technique becomes as important as your strength. And what really flares a knee up in skiing is lots of skiing, one, so the total amount of skiing which you do. If you spend a lot of hours on the hill, good on you. I wish I could do that as well, but it's a matter of caring for your knee while you're on the hill. And have a think about this. If there's more squat angle, if you're deeper in that squat, there's more pressure on those knees, right? If you can get a good separated position for your skiing, this is my downhill ski, I'm going to get a good separated position. My knee can be straighter because I've got a bit more movement from my hip, and there's less knee angle, and that ski is going to grip the snow and make a nice turn. So I've got less knee bend, I've got less knee squat angle, right? That's going to keep the pressure off my knee. So when we think about that, we're saying we want more hip strength, we want to have a great skiing technique, and your skiing technique can be influenced by your boot fit, the stiffness of your ski, the type of ski we're talking about, and by your technique, which is obviously influenced by your skiing instructor or someone who's helping you with your skiing. So it's a complex thing, and we're going to get into some exercises and show you guys some exercises that are really going to help. But think about these things. What can you change? Can you change your technique? Can you change your strength and flexibility? You can always change that. Can you change the total load? Like, how many days are you skiing? Are you doing something in the gym that could be aggravating your knees that's not helping your skiing? And then how can you make some changes for that? Can you change your boot or your ski? Is it your ski instructor that you need to have a chat to about your technique? Or are there some exercises that we need to set you up with to get you better? So what we can do is show some exercises for your strength and for your flexibility, and that can help skiers, it can help runners, it can help anyone with pain in the front of your knee. And we'll get some more stuff up on the site soon. Thanks for listening.